Okay, so you're familiar with the structures and the functions of the respiratory system. So now let's take a look at the pathology. In other words, by the end of this lesson, you should be able to identify the common disorders, diseases that are related to the respiratory system. So let's first take a look at the common symptoms related to respiratory rate. Okay, so these are symptoms, not necessarily specific diseases, but you will see them associated with certain diseases. So remember, a symptom is something that we can see that our clients might be exhibiting. And these are all related to how fast or slow someone is breathing. So let's first unpack this and take a look at this root, PNEA. PNEA means breathing. Okay, so all these terms relate to breathing. So what are the prefixes that we're putting on them? Well, first is Brady, and Brady, if you recall, means slow. We pronounce this bradypnea, and bradypnea is a slow respiratory rate. Similarly, tachy, if you think of like a tachometer in a car, how fast it's going, tachy means fast. Tachypnea is a fast respiratory rate. DYS, difficult or painful. So dyspnea is someone who has difficulty breathing. And A is without. So we have apnea. Apnea is stoppage of breathing. And I just brought this down just a little bit to talk a little bit about sleep apnea. Sleep apnea is that disorder where during sleep someone has periodic episodes where they actually stop breathing. So, can you match these up? Difficult breathing, dyspnea. Fast breathing, tachypnea. Absence of breathing, apnea. And that leaves us with slow breathing, bradypnea. So with asphyxia, we're kind of taking hypoxia another step down. Asphyxia would be where the person has a loss of consciousness now due to a lack of oxygen. So first they would become hypoxic, low oxygen, and then eventually they don't get enough to their blood, to their brain supply, to their tissues to have asphyxia. And that would be that they lose consciousness related to the lack of oxygen. And then the last one, cyan. Cyan is blue, osis is condition of. Cyanosis is a bluish color that comes to the skin related to a lack of oxygen. You might see this primarily like around the fingers, around the mouth, and sometimes in the eyelids. They're some of the first areas where those mucous membranes are that we would start to see cyanosis. Let's see how you can match these up. An absence of oxygen. Anoxia, because anoxia is low oxygen. Bluish color related to lack of oxygen. Cyanosis. Loss of consciousness related to lack of oxygen. Asphyxia. And a low oxygen level. Hypoxia. Now let's take a look at obstructive diseases. So this is bronchitis. Bronchitis is an obstructive disease of the respiratory system. It can be broken down into bronch, referring to the bronchioles, the bronchus and the bronchioles, itis, inflammation. So in this case, the bronchioles and the bronchi become inflamed. So if you look at our picture here, you're going to see that this is a healthy bronchi, bronchus, I should say, and this is one where it's inflamed. Look at the center here. See how much smaller the opening is compared to this one? So you get this smaller airway, so you have trouble getting air through. In addition, the body produces extra mucus trying to coat and seal those areas that are inflamed. And as a result, that extra mucus, that stuff building up in there, causes coughing. So bronchitis is often associated with that coughing, that horrible coughing, because it's the body trying to expel this mucus and get rid of this excess mucus against this smaller airway. Now we also have the term up here, chronic. Chronic means it's a long term, it's an ongoing. So chronic bronchitis is someone who gets this for a long period of time, or often it recurs. They have it, it comes back and it comes back and it comes back. It's not an acute thing. Acute would be it would come on quickly and then go away quickly. But in this case, this is picturing or talking about chronic bronchitis. Okay, another obstructive disease, emphysema. Emphysema is a progressive, long-term disease where the alveoli are actually destroyed. Now, if you remember, the alveoli are these air sacs. This is some normal alveoli here, but look at the alveoli in this person with emphysema. They're actually, you can see, they're broken. So normally there would be some divisions in there or not, and they're enlarged. So they do not work as effectively as they did when they were healthy. So emphysema is caused because of damage that happens to the alveolar sacs. What are some of the things that can damage the alveoli? Most common we often think of is smoking. In addition to smoking, breathing in other contaminants, such as you may have heard of black lung with breathing in coal dust or breathing in asbestos, anything that can go in and cause damage to these alveoli can cause emphysema. But again, the biggest one we see in the Western world is smoking. Now, what happens with this is these alveoli are so distended, people have trouble expelling the carbon dioxide and the out of their lungs. So they're often forcibly exhaling. Commonly what you'll see with people like this is they'll tend to lean forward, because leaning forward pushes up on that diaphragm and helps forcibly push some air out of the lungs. You'll also see these people as they go on in their disease process wearing oxygen, because they don't have as much surface area anymore to bring oxygen into their body, because the alveoli are damaged, so they can't get in enough oxygen. You'll also see something called barrel chest, and this barrel chest is something that occurs because, again, they're forcibly trying to exhale, and in addition, they have air that gets trapped inside. So the trapped in air, accompanied by trying to force air out, causes the chest to take on this very round appearance. And it's called a barrel chest. The most common symptom with this is dyspnea, which is difficulty breathing. So asthma. Asthma is also an obstructive disease. Asthma is an inflammation of the bronchial tubes. Now, different from bronchitis in that this is typically acute and it's typically allergic. It usually comes on very, very, very quickly. So you don't have that necessarily that buildup accumulation of mucus because it's not a slow inflammatory process. It's a very quick onset. And if you know anybody who's had asthma, you've seen that and understand that. And it causes spasms of the bronchioles, bronchospasms. So in this picture, you see a normal opened bronchiole, and in this one that is very narrow due to an asthmatic reaction. The most common symptom, wheezing. It is so narrow of a space that the air is going through, it's causing wheezing. Very similar to like if you have a balloon. If you blow up the balloon and then just take your mouth off and let the air out, you hear a whoosh of the air coming out. But if you blow up that balloon and you stretch the opening so that you're narrowing the opening and then let the air out, you hear that high-pitched noise. That's exactly what's going on in asthma. That's what causes wheezing. So the distinguishing features between asthma and bronchitis, even though they're both inflammation in the airways, bronchitis is usually accompanied by the coughing and that excess mucus production, and it's typically a longer term disorder. Acute is asthma. Asthma comes on very quickly and it's often allergic. And though you do get some coughing, it's a dry cough. It's not that productive cough. And the primary symptom with asthma is wheezing. Croup. Croup is a disorder that happens in children, and it's caused by an inflammation around the vocal cords. So if you look at the top picture here, your normal vocal cords, and you can see all the space that's in here. If you look at, I'm going to do it in yellow, there we go. If you look at this bottom picture, we now have inflammation of the larynx. And the space in here becomes much more narrow. And as a result, you get this barking kind of cough that comes along. The larynx is irritated, so the body coughs to try to get rid of the irritation. And the cough that's caused is because the narrowing is a barking kind of cough. This is not contagious. It can come on very suddenly. And usually we encourage a moist, warm environment. You turn the shower on, take the child into the bathroom and close the door. And that moisture it goes and adds moisture to the airway and helps calm it down and helps calm down some of that irritation and reduce the coughing. But basically, this is a disease that's going to run its course. Diphtheria is another upper respiratory disease, and it affects the pharynx and the tongue. And what it is, it's a bacteria that gets in. Primarily, we see this in children, and it's a bacteria that can cause these whitish patches on the back of the throat, in the pharynx, and on the tongue. And it's also accompanied by fever and aches and generally not feeling good. But because it's a bacteria, it won't just go away on its own. It needs to be treated with an antibiotic. And if left untreated, it can actually get into the bloodstream, travel to the heart, and cause heart damage. So diphtheria does need to be treated when it is found as quickly as possible to limit the amount of damage to other organs in the body. However, we don't see it a whole lot in the United States, and the reason we don't is because it's part of our childhood immunizations. DPT is diphtheria, pertussis, and tetanus. And the DPT vaccination helps prevent children into adulthood from contracting diphtheria if they are exposed to it. Another upper respiratory disease that we see, again, primarily in children, is pertussis. Now, pertussis, the common word for it is whooping cough. This is bacterial infection that occurs and it causes this really noisy cough that sounds like a whoop and noisy inspiration. In other words, when someone breathes in, we hear the noise. And it got its name because the whooping sound that accompanies this. Now, again, if you recall from the last slide we talked about, pertussis is part of the childhood immunizations. The DPT, the P in there, is pertussis or whooping cough. So again, we have vaccine that helps keep the numbers of this very low here in the United States. Although we did see a resurgence of this a couple years ago, and we believe, that that's primarily due to a lot of parents, I shouldn't say a lot, but a number of parents now making the decision to not have their children vaccinated during childhood. And so we are seeing a resurgence of pertussis and some diphtheria in the United States that we hadn't seen for quite a while. Epistaxis. Epistaxis is a nosebleed. It's the fancy term for saying you have a bleeding nose. Can be caused by numerous things. Sinusitis, sinus, itis, inflammation of the sinuses. Again, can be caused by allergy, bacteria, viral, and you find the cause in both of these disorders and you will get rid of the symptom or get rid of the disorder. Laryngitis is along those same lines. Laryngitis, laryngo is what part of the body? The larynx, which is your voice box. So laryngitis is inflammation of the voice box. In this case, it's going to interfere with communicating, with speaking. Two terms related to laryngitis. The first one, aphonia. Aphonia. Phonia is speech. Aphonia is without speech. If someone has aphonia, they can't speak at all. Most often, though, people with laryngitis get dysphonia. Dysphonia is difficult or painful speaking. Again, similar to epistaxis and sinusitis, if you figure out the cause, then you can get rid of the laryngitis. If it's bacterial, antibiotics. If it's viral, it's rest, fluids, and anti-inflammatories. If it's allergic, get rid of the allergen, etc., and it'll go away. And the last one, pharyngitis. It's very, very similar to laryngitis, except this is inflammation of the throat. Laryngitis, inflammation of the voice box. Pharyngitis, inflammation of a throat. When you have a sore throat, you have pharyngitis. Okay, things that go wrong within the pleural cavity. Okay, think about it first. Where is the pleural cavity? Now, we're inside the pleural cavity. Think about what is inside the pleural cavity, the lungs. Two of the disorders that we will see that relate to the pleural cavity are a hemothorax and a pneumothorax. Hemo means blood. Thorax refers to the chest. So hemothorax is blood in the chest cavity. It's usually caused by trauma. If you look in this picture down here, you can see on the left pleural cavity, the left lung is affected by a hemothorax. There's blood in the space where the lung should be. And as a result, look how small this lung is. Often we'll call this a collapsed lung, and it is collapsed due to blood in the chest cavity. Now, similarly, we have a pneumothorax. Pneumothorax is air in the chest cavity. And if we look down at this picture, you're seeing air in here outside the lung. And as a result, air outside the lung causes the lung to what we call collapse. It causes pressure on it, and therefore the lung can't expand. Often it can be due to trauma. It also can be due to some diseases, like emphysema can cause this, is one of them. Sometimes this can even just be spontaneous. Like people have disorders that cause spontaneous pneumothorax. They just happen from nowhere. They have difficulty, extreme difficulty breathing. When they go to the doc, they do an x-ray and we see that they have air in here. So we do a procedure to get out whatever is in there. If it's a pneumothorax, we put in a chest tube and we allow the air to come out. If it's a pneumothorax, we put in a chest tube allowing the blood to come out. And in the last picture here, we're showing that you can have both. You can have both hemo and pneumothorax. If you have both, because blood is heavier, the blood tends to accumulate at the bottom of the pleural cavity, and the air rises to the top of the pleural cavity. So the main thing is get out whatever's in there, and the lung will be able to re-expand. Okay, diseases specifically related to the lungs. Tuberculosis. Tuberculosis, commonly known as TB, is a bacterial infection. It is a bacteria called the Mycobacterium tuberculosis. Not that you need to know that, but it helps me remember that's a bacteria. And the bacteria get breathed into the body. So someone is walking around breathing this stuff out. It's attached to droplets. Someone else walks by or is talking to them and breathes in the droplets, and next thing you know, now they've created a home for the tuberculosis bacteria. And that's literally what it does. Tuberculosis sets up a home in the lungs. And when you look, you'll see a whole area of the lungs that look dense. And it creates these heavy walls around it like a fortress, which makes it difficult to treat. One of the other symptoms that we see with tuberculosis, and it's a very classic symptom, is hemoptysis. Hemoptysis is spitting up blood, coughing up blood. And that's caused by the irritation that these bacteria are causing inside the lungs. Now, all of you at some point in time have had a TB test, and that tuberculosis test is doing just that. It's testing to see if you have ever been exposed to tuberculosis. Doesn't say you have it or you don't have it. It just shows if you've ever been exposed to it. The only way you can truly diagnose it is you have to do a chest x-ray and you see the area that's walled off, and then you do a sputum culture to culture out the bacteria that's in the sputum. If it comes up positive, then the person goes through a long-term course of antibiotics, and we're talking months of antibiotics. It takes that long to kill off all of those bacteria that have set up a house inside the lungs. Another very common lung disease, pneumonia. Pneumonia is a lung disease that has two parts to it. One, the alveoli become inflamed, so something caused them to become enlarged, inflamed, and it's accompanied by a buildup of fluid in the alveoli. So if you look at this picture, you can see up here are the normal alveoli, and down here you have they're slightly inflamed, a little larger, and look, you have fluid in here. And when there's fluid in here, the oxygen exchange can't happen because you're covering that area where the oxygen and carbon dioxide exchange into the capillaries. Now, typically, pneumonia is often associated with other diseases or disorders. Like someone who's had another respiratory disease and then they develop pneumonia. So it's often a secondary issue. The other place where we come and see pneumonia is after surgery. Someone who is laying around and not moving. It allows fluids to settle in down in the lungs, and if they don't get moved out, pneumonia can set up. It can be bacterial, it can be viral, it can be fungal. There's a variety of reasons you can develop pneumonia. Another lung disease, cystic fibrosis. Now, it's categorized as a lung disease, but it's actually a genetic disorder. And genetic means, it's a result of a mutation that's gone on or something that's happened with the genetic material, with the DNA. And in this case, these people are missing the DNA that tells them to create certain enzymes in the body. And these are enzymes that are located in the lungs and in the pancreas. So what happens is, because they're lacking these enzymes, it allows mucus, excess mucus, to build up. So the walls of the bronchioles become thick and excess mucus builds up in here, and it becomes very thick and sticky mucus. Now, that causes the airways to get clogged up and difficulty for air to come in and out exchange. Because this is genetic, we can't just give a pill or a shot or anything and make it go away. It's a lifetime disorder. So as a result, one of the things that someone with cystic fibrosis has to do is something called chest percussion. Several times a day, they have to basically beat on different areas of their chest to loosen up this really thick mucus so that they can then be expelled and gotten out of the airways. They also have digestive issues. They're usually very thin because they have trouble absorbing nutrients because the enzymes that are missing from the pancreas. So as a result, they often take something called digestive enzymes to help them digest and absorb their food. Unfortunately, people with cystic fibrosis tend to have very fairly short lifespan. Usually don't see them living past their 30s. Okay, atelectasis. Now we've kind of talked about this when we've talked about other disorders, but atelectasis itself is called a collapsed lung. So if you look at this x-ray, what's missing? Right. We can't see the lung on the person's right side. Can kind of see it here a little bit. But look at the difference between this and this. Now down here, let me give you a little bit of here. This is the heart. This is the heart resting right in here. And the lungs, when air is in the lungs, the x-rays pass right through and cause this dark pattern. But look, there's very little air in this lung on this right side. It's because the lung is what we would call collapsed, or an atelectasis has occurred. So atelectasis is the medical term for a collapsed lung. So right now, think, what are two disorders that we talked about that could cause atelectasis? Okay, practice makes perfect. Review your word parts. Know the meanings of all the word parts. Practice by using the activities in Canvas. And if necessary, go back and review this video lecture as many times as you need until you have a good handle on the common diseases and disorders related to the respiratory system.